luxury vehicles.
Morning, the spread of the COVID-19 Omicron variant now picking up in the United States. And joining us this morning to share his thoughts on what we can expect in the coming weeks and months is Dr. Anthony Fauci, who, of course, is the director of the National Institute of Allergy and Infectious Diseases, as well as the chief medical advisor to the president. Dr. Fauci, thank you for joining us this morning. It's great to see you on a day where the news continues to get worse. Help us with this. So many business leaders, business owners are watching us this morning, especially in the tri-state area where the numbers continue to surge. By some estimates, by next week, the positivity rate could cross 20%, possibly 30% by Christmas. Do you believe that businesses should be bringing workers into the office place? And what do you do about environments where people can't wear masks, restaurants and the like?
Well, those are difficult situations. First of all, you're right. We are having a surge, both a Delta surge, the Delta variant, but also we're having a rather substantial increase in percentage of the new Omicron variant, which has the unfortunate capability of spreading very, very efficiently with a doubling time of about 3 days. So the recommendations are what we've always said. I mean, we've got to get the unvaccinated people vaccinated, and boosters really help very, very much in protecting you against infection, but particularly against severe disease that might lead to hospitalization. So the recommendations in general, if you're vaccinated and not yet boosted, go get boosted. And with regard to just how you go about your daily life, you've got to abide by the recommendations of the CDC that when you're in an indoor setting, that's a congregate setting, where you do not know the status of vaccination of the people around you, to wear a mask in that indoor setting. That's the best we can do. Unfortunately, we have so many people in this country who are either not yet vaccinated at all or who have not gotten boosted, and we've got to get those people vaccinated.
Doctor, but given the breakthrough cases and what we've seen about the lack of efficacy without the booster, at least, do you think the CDC at this point should reclassify the definition of what it means to be fully vaccinated? I ask because, as you know, many restaurants and public spaces in many parts of the country, as long as you're, quote, fully vaccinated, you can be indoors without a mask, and what kind of message that sends and what the health implications of that are.
Well, that's certainly on the table. Right now, it is a bit of semantics in that fully vaccinated for the purpose of the regulations and requirements that people have as to be what are you considered as being fully vaccinated. But there's no doubt that optimum vaccination is with a booster. I mean, there is no doubt about that. Whether or not the CDC is going to change that, it certainly is on the table and open for discussion. I'm not sure exactly when that will happen. But I think people should not lose sight of the message that there's no doubt that if you want to be optimally protected, you should get your booster.
The CDC is now recommending effectively against the J&J vaccine, or at least favoring the Moderna and Pfizer vaccine. Do you think it was a mistake from the beginning to recommend the J&J vaccine, given what was clearly the lack of efficacy relative to the others, and now some of the other troubling aspects that we've learned?
Well, the shift and the change right now that occurred yesterday regarding a recommendation of a preference for the mRNA over J&J really was nailed down by the very recent data that there are more of these adverse events than was originally thought. Still, one can use the J&J, but what the CDC was saying, that when you look at the overall data, particularly taking into account the safety data with regard to adverse event, that if you had the choice, favor the mRNA.
As you know, we are in holiday season and there are holiday parties. You've talked about getting together with your family during the holidays, and you've recommended testing and the like. At what point would you reassess that? And how would you think about holiday parties, even those with tested, in environments and areas? As I said, by next week, if you do the math logarithmically, New York could be in a place where the positivity rate could cross 25, 30%.
Well, you've got to just take things one step at a time and take a look at how things evolve. I mean, obviously, if you are vaccinated, your family's vaccinated, you have friends who are vaccinated and hopefully also boosted, you could still enjoy a social gathering, generally in a home. You've got to be careful when you go into large public indoor spaces where there are a lot of people there, and that's the reason why you should be wearing a mask under those circumstances. But you've got to follow what's going on. If the counts keep going up and the test positivity keeps going up, we may need to be more restrictive. But for right now, people who are vaccinated and boosted should feel reasonably comfortable. The risk is never zero, that's for sure.
But
under any
what's the number?
circumstances.
What's the number you reassess at? You just suggested, I think, perhaps for the first time, that you would be forced to reassess if the numbers go up. At what level? Meaning, if you hear that the positivity rate is 25% in a particular, or 30%, does that change?
I'm not going to give you a number. I think you just have to look at all the different factors. You've got to look at people who are getting infected. You've got to look at the seriousness of the infection, the rate of hospitalizations. All of those things you look at when you make a determination about how restrictive you are going to be. And those things just roll out in real time, and you take it step by step. I can't give you a number now. Then all of a sudden, that becomes the set number. And I don't have any real scientific data to feel very comfortable about a set number, and that's the reason why I don't want to give it to you.
The J&J news is kind of it's troubling, and it's just in terms of the vaccine hesitant. The messenger RNA vaccines have been given to billions of people. The speed with which that technology was developed and the safety profile that we know so far is staggering. And the adaptability of the vaccine itself to new mutations, it's amazing. I don't know, someone needs a Nobel Prize, obviously. Maybe they already got one. But
no, they will get it probably.
Can you think of any type of disease pathology where we just don't know if there's an effect a year from now or 2 years from now? I can't think. I mean, it has a very short half-life. The messenger RNA is gone. But can you think of any way where we just don't know whether there's something that we might say about messenger RNA 6 months from now, a year from now, 2 years from now? Because I think that feeds into the vaccine hesitancy that we're still seeing.
Yeah. It would be unprecedented to see something 6 months, a year from now associated with any vaccine. We've never seen that. Usually you get reactogenicity, which occurs within 24 to 48 hours after a vaccine. Then there are adverse events. Almost all of those adverse events occur within 30 days or 45 days at the most. The idea of having an unexpected adverse event 6 months or a year later, I mean, nothing is impossible, but that would be absolutely unprecedented if that occurred.
I want to ask you quickly about how you think where you see the incubator for these new mutant strains. We had one very smart person, I know you know Len Schleifer, he talked about the South African variant, which there were immunocompromised people there. One that had had COVID for 156 days, but no real immune system. So it was able, just in that individual, 56 different mutations. So that's one way of generating mutants. Is that the way it happens, or is it the unvaccinated, the millions of people as the virus is able to jump from person to person individually when the unvaccinated? Is that where the mutant strains come, or from both? Right. Because I guess what I'm getting at is, well, people without immune systems, we can never make sure we vaccinate them till we're blue in the face and they could still generate a mutant.
Well, I think the answer to your question is both. The number of mutations and amino acid substitutions that are seen in Omicron is really rather unprecedented to get those many, and particularly that profile of mutations, some of which are really very unusual. It is more likely, although we don't know for sure, that that's exactly what happened, that the virus got into a person. You usually clear the virus from the body within a period of several days. If your immune system is severely compromised, it gives the virus the opportunity to continue to replicate in a person. And when you give it the opportunity to continue to replicate with a little bit of an immunological pressure on it, to the extent that an immune-compromised person can give that immunological pressure, that's how you get that very large and complicated constellation of mutations that we see with Omicron. That is the most likely scenario about how that happened, although there are some other theories, but that's the most likely.
Dr. Fauci, we've been thinking that maybe Omicron is not going to be as deadly as we've seen with some of these others, but it does seem to spread very, very quickly. The numbers that the CDC released yesterday were pretty sobering. This idea that we're going to be getting 1.3 million cases, additional cases of COVID between now and Christmas. But the number that concerned me more was the idea that we could be seeing something like 15,000 deaths a week starting January 8th. That's their expectation. Is that because we think Omicron may be worse than anticipated, or is this Delta that we're still dealing with in terms of these really severe outcomes?
Yeah. You know, that's a good question. So first of all, the data that we have from South Africa gives no indication that Omicron is more severe. There is some suggestion, and it really is only a suggestion, that it might be less severe. And the reason that that is suggested is that in South Africa, when you look at the ratio where there are the most cases, if you look at the ratio of hospitalization per number of cases, it's lower. The duration of hospital stay is less in number of days. The requirement for oxygen is a bit less. That could either be due to an inherent but an inherent lower virulence or inherent lower pathogenicity of the virus, or it could be due to the fact that so many people, more than 80% of the people in South Africa, have already been infected with Beta or Delta, so that when they recover, they have a considerable amount of protection, not against infection, but protection against serious disease. So that's the issue. One of the things we got to be careful about, that if you start assuming, and it really is only an assumption, that it might be less severe in general, that can be completely overridden by the fact that it is so extraordinarily transmissible that even though you have a less of a percentage of people who would get hospitalized, when you have a larger number of people getting infected, the total amount of hospitalizations is going to be more. And that's just simple math.
I mean, the reason I ask is I'm trying to figure out and gauge how concerned I should be. I've heard of a lot more people in the last week who are fully vaccinated and even boosted who have gotten COVID. Is this
right?
A
yeah,
situation?
And what we're hoping, no, that's a very good point. And we've got to admit, we are seeing a lot of breakthrough infections. And there are a number of reasons for that. One, there's waning immunity, which is the reason why we strongly recommend that when people are eligible to get boosted, that they get boosted. That's for sure. The somewhat encouraging aspect of that is that when you're vaccinated and boosted and you get a breakthrough infection, the likelihood of your getting seriously ill is very, very low. Not zero, but it's very, very low.
Dr. Fauci, the White House was asked about a week ago whether effectively the government should provide free antigen tests. This is something that many other countries in Europe have done. The White House effectively scoffed at the idea. I know they have pushed for insurance companies to pay for it. Do you think that's a mistake? Do you think that the government should be providing tests for free?
Yes, and there are a lot of tests that are for free. Obviously, some of them are, quote, reimbursable, but there's a distribution now of millions and millions of tests that are going to be available at various community and health centers, that they will be truly free, where you go in and get it. Also, I think it's not appreciated that the government has invested several $1 billion to make anywhere from 200 million to 500 million tests available per month. And that's a lot of tests. So I don't think you could say that the government scoffed at the idea about free testing. We are providing free testing, actually.
I'm wondering for where we should expend the most energy, I guess, on both, on a universal vaccine for all coronaviruses. That would be great. But then I think about therapeutics. and whether there's a way, I mean, there's not that many genes, right, in the coronavirus genome. What do you estimate total? It's less than 20, isn't it, the functional proteins?
Yeah, it's 30,000 it's 30 kilobases. It's 30,000.
And how many would that code
pairs.
for, actually, introns, as they say?
No, I'm not sure exactly what it is. I don't want to
Well,
take
it's not that many. So
it's 30
how would you do it?
right.
How would you do it? Would you, if you were going to develop a universal vaccine for all coronaviruses, how would you, does it have to be a surface protein that mutates quickly, or would you be able to target it against one of the essential genes in the actual, the way that the virus actually works?
We're looking at, no, we are looking at all aspects. We're looking obviously very heavily at the spike protein, which is the most important, but there are other proteins, nuclear protein, capsid proteins. There are a number of proteins that are being looked at as targets. That is a major priority for us, to develop a pan-coronavirus vaccine. In fact, I wrote a paper on that came out of the New England Journal of Medicine just a few days ago, describing the importance of that. So I'm pleased that you brought it up, because it is a very high priority. Because we know from history.
Yeah.
Oh, go ahead.
No, go ahead. I'm sorry.
As we know, historically, we've had 3 outbreaks of pandemic or potentially pandemic coronaviruses in the last 19 years, from 2002 with the original SARS. So we really are absolutely compelled, I believe, to make a pan-coronavirus vaccine, which we are working on.
It seems like you could develop a therapeutic for some essential, one of those essential proteins, whether it's a protease or a polymerase or something like that, that works in all of them and is conserved.
Right, but that's a treatment.
Right.
Yeah, but that's a treatment. You know, we don't want to get the audience mixed up about a vaccine or a treatment.
I don't want to mix
You're
them
right.
up, but what's easier? What's easier to develop, and wouldn't that work? You could take a pill if you got any of them.
Well, yeah, you know, you can't say before you do it what is more easy than the other. The easiest one is the one that you make it. If you're successful, all of a sudden it automatically becomes
maybe we'll
easier.
do both.
No,
Maybe
we're doing both. Yeah,
Okay.
we're going to do both. Absolutely.
Dr. Fauci, a lot of folks are getting on airplanes or planning to get on airplanes over the next week or two. They, of course, will be asked to mask, but given the transmissibility of Omicron, does it change the dynamic? You know, a lot of people get on a plane, they wear a fabric mask. Does that even work?
Yeah, I mean, there's no doubt that fabric masks work. I mean, there are different grades of masks that have different degree of capability of keeping out aerosol and droplet particles. I mean, obvious, the N95 is the best one, but they're relatively uncomfortable to wear. Not a lot of people wear them. But a regular surgical mask, as well as a cloth mask, is fine.
And finally, would you jump on an airplane?
Would I? If I had to, I would have no problem getting on an airplane. I'm vaccinated. I'm boosted. I know we have to wear a mask on an airplane. You wear a mask when you get to the airport. I do not have, given my state and what I do, I'm sort of locked in here in Washington, D.C., so I have no intention of getting on a plane. But if I had to, for family or other reasons, I would not hesitate to do that.
I had one more thought to ask, because I'm looking at Omicron, and I'm hoping it's one of these situations that we've seen in the past where as we go forward, it gets less and less virulent, and people say that maybe we're going to see COVID endemic and something that comes again and again. The difference between Delta and Omicron, if it really is less virulent, the stigma of getting COVID is still there. If it becomes a much less severe disease, should we be talking, let's say the next, not the next one, the next one after that, where it really is just like the flu at worst, do you think we'll still be talking about possible lockdowns and possible, all these things that we now, because of COVID, do we ever make the switch to, wow, this is something we're going to have to live with, and we can't, you know, close down and not have holidays and do all these things with a much less virulent form of COVID?
Sure, I think that's entirely conceivable, that as it evolves, you're going to see a situation where we adapt to it in the sense of it becomes less severe for the population. We hope that's the case. That could possibly have happened many, 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 many years ago with the original coronavirus. That's our common cold coronavirus, that perhaps many years ago they were pandemic viruses, which as things evolved over many years, they finally got into a situation where they were merely relatively insignificant common cold viruses. That is conceivable that ultimately happens with the pandemic we're going through right now.
And Dr. Fauci, wanted to ask you about vaccine mandates, in part because it continues to be a national debate. Dr. Scott Gottlieb comes on this program regularly, and one of the things that he has said repeatedly is that he believes it's possible that those mandates have become counterproductive, not just towards getting people to take the vaccine today, but what it does to the psyche of Americans around taking other vaccines in the future. Do you agree with him?
No, I don't know where he got that. I know Scott well. He's a good friend. I'm not sure what he was referring to. I mean, mandates, that's a radioactive word. Requirements, people seem to respond better to that. They work. If you look at companies like United Airlines that require their people to get vaccinated, they're about 99% vaccinated. The federal government, the federal workers, we have about 97% vaccinated, 99% compliant. You know, one of the problems is we're never going to get out of this outbreak if we still have 50 million people who, for reasons that are still very, very difficult to understand, refuse to get vaccinated when you have a virus that's killed 800,000 Americans and caused 50 million infections. So if people still do not want to get vaccinated, sometimes you have to, for the common good, make requirements.
Dr. Fauci, thank you so very much. If we don't see you, talk to you before the holidays, have a great holiday, and we hope to see you soon. Stay safe.
All right, thank you. You too. Have a good holiday. Thanks.
Thanks.